Hey, what's going on, everybody? Ryan Weber here with Fittynomics.com. Today I'm with a good friend, Dr. Volk. Dr. Volk is a chiropractor. To give you a quick little background, I was working out in the gym. Yeah, imagine that. Strained my back and could barely breathe. I had no idea who I was going to go to, who I was going to talk to. So my sister actually recommended this Dr. Volk. Gave him a call. He got me in the same day. Worked some magic. My back was amazing. And, good relationship ever since. So, Dr. Volk, why don't you go ahead and just let the people know a little bit about who you are and what your background is, and we'll go from there.
Yeah, my name's Dr. Charles Volk. As Ryan said, I'm a chiropractor. Got my degree in Kansas City, Missouri. The irony there is Cleveland Chiropractic is the name. That happens to be the name of the last name of the founder of that college. Went there for a few years, came back. Obviously, about a year or so I worked for another chiropractor, and then eventually started up my own practice. And I suppose kind of people always ask me why I got into this. One of the interesting things was my mom was in an auto accident when I was younger. Chiropractor happened to come to the house one night, and I was feeling ill. I just kind of had a stomach ache. And the guy adjusted me right there at the house. I was probably like 7, 8, 9 years old. I don't remember. And within like 10, 15 minutes, I felt better, went out, had dinner. Never thought another thing of it until I got in a car accident about, 16, 17 years old. And then I started kind of going through that routine, and after a second car accident, and then it just kind of seemed to fit. I wanted to be a medical doctor of sorts. I wanted to have my own business, and it just kind of, everything fit for me personality-wise, and just seeing that how my chiropractor took care of me, how he took care of patients. I've kind of emulated that to some degree, and it just seems to work on a day-to-day basis for me.
Oh, that's great. So how many years have you been practicing chiropractic medicine?
Well, I graduated in 1998, so it's been about 14 years now. 14 years? Yeah.
Wow.
And it doesn't seem like it. It just seems like maybe a couple of years ago.
Time
but nonetheless, yeah, time just keeps growing, and since I opened up the business here, it's been steadily increasing. I'm very happy with that. Keep adding more files and more people. Referrals. Obviously, that's what I love the best is when you refer to our office, how you then refer other patients, and how it just kind of cascades from there.
Yeah.
People actually have an understanding, at least a little bit, when they come in here, what to expect, based on your, predicament, what you've told them about, as well as, even if they're a little bit kind of hesitant, it's really nice to have a referral, knowing that you've been here and I've taken good care of you, and what they can expect, from that.
Right. I mean, when something works, obviously we're not afraid to go ahead and tell our family and friends about it. So in this case, chiropractic therapy has been, it's been a lifesaver, it really has. When you work out in the gym, if you have a physical job, if you play a lot of sports, chances are, your body's going to kind of take some use, wear and tear, abuse, and, more than just taking ibuprofen or trying to stretch, sometimes a little bit more is needed. So with that in mind, I know a lot of the times my friends and family, friends who I'm trying to convince to come to a chiropractor, will go to a doctor and maybe they'll get some x-rays done. They'll get a couple of exams done, and then the doctor says, I'll tell you what, go ahead and do these stretches and maybe take some ibuprofen, pain inflammation pills, and kind of go on about treating the therapy that way. I think that's great, but maybe for somebody who doesn't want to take all the pills, and I'm not really saying that, going into a doctor's office, this isn't the right way to do it, but there is an alternative therapy, alternative medicine. So, in your words, how would you describe where chiropractic medicine fits into a situation like that?
Well, actually, Ryan, I agree with everything you said there, because chiropractors do also like to work in concert with the medical doctors or medical profession.
Sure.
Honestly, think about it. Chiropractors don't do everything. Medical doctors don't do everything. So if we could work together, honestly, chiropractors don't prescribe medications at all. I can't even prescribe you to take an anti-inflammatory. My license doesn't allow it. I don't prefer to do it because of all the side effects that are potential there. However, if you go to the medical doctor, they will prescribe what they feel is necessary, and with the group, or it's like a sports team working together to help you as a patient. So we work together as a team to do what chiropractic does best, mechanical of sorts, if you will, and then with the medical side with an anti-inflammatory or whatever it is that they feel. We also do physical therapy in our office. That's one of our licenses to do physical therapy in the state of Ohio. As chiropractors, we really feel that more majority I would say is not the problem is that you missed a medication. That's where this kind of crux comes in, where people kind of really take that kind of split road and go, oh yeah, we don't feel that you're missing a medication that caused your pain. As you suggest, working out, sometimes one side's stronger than the other.
Right.
Maybe you took a tumble as a kid,
Right.
and you dealt with it, you weren't bleeding, your mom brushed you off and said, okay, you'll be fine, and years later. But honestly, even childbirth is one of those things. We treat infants. It's amazing how well younger people respond. Their body's constantly changing and adapting. They just love it. Their body says, okay, I can move better, I can breathe better. Think about a little baby that's colicky. Doesn't mean, again, always the chiropractic works, but the fact that sometimes that little infant has a headache. You ever see them sitting in a car seat when you're driving around and they're sleeping, and their head's just kind of, bopping around?
Not the most comfortable position you could probably be in.
Yeah, and you do everything, you change them, you feed them, and everything, and they're still colicky. Chiropractic is add nothing to the body, take nothing away from the body. So we don't do surgery, although we do refer to them when necessary. But this little baby or teenager or even a young adult as yourself, it makes common sense. If we work with you a couple visits and we don't make you better, we make you worse, hands off. Yeah, let's definitely get you referred to the medical side and do x-rays and what have you and find out what else could be going on there. But if it works, I'll tell you what, it's almost like flicking a light switch on. Sometimes just 2 or 3 visits and you're like, well, all right, I'm starting to feel better. But oftentimes it's kind of an ongoing process. Every day that you want to feel good, those are the days that you do the things that got you there. Obviously, it's more than chiropractic. You have to do your physical, your exercises, eat nutrition. You have to be, mentally sound. All of these things work together to help you being the best person that you can be. So there's physical stress, emotional stress, financial stress. All these things will beat you up, beat your body up, and you'll tense up, and then pretty soon that tension leads into the headaches, which is what we deal with, and all these other musculoskeletal things. And it just, again, it makes common sense to me. That's why I got into the profession, why it seems to help the patients that come in. And having an open mind also helps, because if you come in here and you think, oh my gosh, it's not going to work, well, sometimes it really doesn't work because you never gave it a chance. So,
sure.
More
often than not, I think, I know whenever I've come in here, you've definitely helped me out.
Mm-hmm.
Working as a fireman, playing sports, being physically active 5 or 6 days a week in the gym. As I said before, everyone carries their stress in a different area of their body. For me, it's a lot more upper back and lower back. So an awkward position, maybe lifting something up. And we can even make that much more minor, where if you're a mother picking up, an infant or something like that, if you bend the wrong way, even if you're trying to adjust maybe, a bookshelf, anything, you're trying to move something small, you will get these cracks and pops in your back that you're kind of like, wait a second, what was that? And sometimes people think it's much more of a serious injury. Well, the body's going to make, noises. It's going to adjust itself. So when adjusting gets out of line, chiropractic therapy is great. So I guess with a couple examples like that in mind, and so far it's been great, can you go over maybe a couple of some common injuries, maybe some car accidents, sport-specific lifting injuries, where somebody would come in and they'd want to see a chiropractor for?
Oh, absolutely. Obviously car impact is tremendous, even though all the things are built into the car, the bumpers and airbags and everything. That airbag shoots out over 100 miles an hour. And sometimes you're in this position flying forward at an instant's notice, and now all of a sudden you're being propelled back. The seat is a big thing. If you're leaning back like this driving, and you got this big gap between your neck and the seat, well, that's all this distance your head has to travel when you get hit. If you're sitting upright, it's a better option. At least your head won't travel back near as far if that headrest is literally about the width of your fist away. Okay? But the difference is all that force goes into that car somehow. And they've done really well. They have where the hood will buckle on you and everything. That force still goes through that car somehow. It gets absorbed in some areas. What doesn't get absorbed by the car gets, sent directly into you as the occupant.
Right.
So it's like, being in one of my car accidents, I've had many, unfortunately, it felt like somebody took a big croquet mallet and just whacked the back of my car. And it was like, oh my gosh, what was that? And then, everything starts, spiraling out of control. And I'll tell you what, with that one in particular, I called my chiropractor. Funny, most people think that I go to see one because I also need to go see a chiropractor. But I called him up right away and says, I'm either seeing you tonight or tomorrow. And I'll tell you what, probably within maybe 10, 11, 12 visits, I was fine. I kept working. I kept treating patients, you know, and it's just, that's honestly the way it goes. You know, and I've been through probably 4 or 5, and you want to think that they were all my fault, but they weren't.
So chiropractors use chiropractors.
Absolutely.
Good.
You know?
So we talked about a car accident. What other kind of injuries? Maybe something more specific where
Yeah.
you want to see a chiropractor.
The more common, honestly, when workers' comp gets involved, those kinds of things, it's a lifting injury. Sometimes, you know, you're in the wrong position, and that's probably the biggest thing is the position. It's not always what you lift, it's how you lift it. You have to keep your spine in an erect or straight up and down and use your lower legs to lift. And if you don't do that, yeah, a lot of people don't do it the correct way, and they can get through the day, but their back gets more sore. And eventually it's one of those times that you just kind of turn and twist the wrong way while you're lifting, and it's a coupled motion because your body will bend forward and backwards, nice and easy. It'll bend side to side. But if you do both of those together, you twist and you bend, that's all it takes sometimes when you're lifting up with force. Gravity is going this way and you're lifting this way. It's called a shear force. And when you do that, that typically happens in the lower back, right around the belt line when you're bent over with your legs straight. If you bend your knees and use your legs, the quad muscles in the front to do the work, you're better off with that. A lot of people are kind of lazy or get tired, fatigued is a big thing. That all helps to set this up, you know. So you go to work, you're doing pretty good in the middle of the day, and as the end of the day approaches, you're getting tired, you're getting a little sloppy, you bend down, you pick up the wrong thing in the wrong position, it's a little heavier than you thought, boom, there you are, either stuck in that position or you're down on the ground. Those things, I'll tell you what, again, they really respond to chiropractic because typically what happens is that shear force we talked about before is ripping and tearing of the muscle and or ligament. That's the definition of a strain. Once you do that, you disrupt that tissue, it is no longer stretchable, your body starts to tighten up with muscle spasms. That's one of the things that you have with pain, why the anti-inflammatories typically give it, chemically at least. Once you do that, the muscles, as they tighten up, lock the bone from moving any further so that you don't further injure it. Now you're left in this position going, oh my gosh, I don't want to move because it hurts to move. Well, yeah. Once we get through a full exam with you, sometimes we send you out for x-rays, we can at least do number 1, physical therapy, ice cold, some muscle stim, which is a therapy to help relax the muscles. Once we can get you safely adjusted, or I like to use the word untwisted because your muscles get twisted up in a knot. If we can untwist you, it's almost immediate. Not that you're going to be 100% pain-free with one adjustment, but it's like taking that 1,000-pound pressure right off of the spot that was hurting, and you can start to breathe again easier. And it's like, okay, I can tolerate this. Now you might be slow, and sometimes it's going to take, 4, 5, 6, 10 visits. It just really depends on how old you are, what kind of shape you're in, obviously. And all these kinds of factors. So
sure.
A lot of people have the adage, unfortunately, once you go to a chiropractor, you always go to the chiropractor. Well, the only truth to that is that I tell people you will come back to my office or any chiropractor as long as what they're doing is helping you. And you may go just like you go to the dentist. You go to the dentist whether your teeth are hurting or not, at least twice a year for a checkup. Same is true with chiropractic. Not only for adults, I mean, kids need it too. They're into sports, they're growing, they're changing. Little infants, I know my kids fell out of cribs, and they get into doing a monkey business that they shouldn't be doing, and they fall, the pratfall where they fall straight on their sacrum is terrible.
Right.
And those kinds of things that you kind of pick the kid up and dust them off, and you think that they're okay, kind of leads later into life. Scoliosis could be something that's lurking in there. And that's a curvature of the spine. We should be standing straight up and down. Most people appear to, but if we as chiropractors look and determine, that shoulder's down a little bit over here. Or if you're working out in the gym and you're doing a bench press and all of a sudden, one side's stronger and easier to get up and the other one really struggles, there's a problem back here. Something's not working correctly. So those kinds of things all fuel the fire to maybe you've done these things all your life and you never had a problem. Boom. That's the last precipitating cause. That's now why you're in pain, because you had no idea that you had a weakness in your back, with the scoliosis as the example. So these all lead into chiropractic.
Right. And those are great examples, great explanations. So kind of recap a couple of things you said. Chiropractic therapy is not age-specific. You've mentioned as young as infants,
Yes.
to adolescents, to much more mature individuals, even into the more geriatric population.
Absolutely.
Everybody comes to see you.
Even my grandmother, who's 95.
Right. You're a medical doctor yourself?
Not a medical doctor.
Medical doctor?
Chiropractor.
Chiropractor, okay.
And just so the people get that understanding, we are a doctor. We have, all the background. We go through state board testing, and so forth. But as a chiropractor, we can only treat certain things. We can't treat everything. Medical doctors, they can't perform chiropractic. Go figure.
Sure.
So that's why we need, again, work in concert as a team with one another.
But you have good working
Yes.
relationship with several other medical
Absolutely.
practitioners. That's awesome.
Yes.
Now, if somebody is maybe on the fence about chiropractic therapy, they're in a couple of minutes, I think we're going to walk back and maybe just give a quick demonstration of what somebody
Sure.
can expect when they come to see you.
Yes.
But if they're on the fence and trying to figure out, is it for me, is it not for me, maybe a couple of things you could tell that person.
Well, probably the biggest thing is ask around. I mean, you have to ask friends, family, if they've gone. And if there are negative, comments, well then, either from family, if they don't like chiropractors, maybe they've never tried a chiropractor. How do they know? They've only heard from somebody else down the road. So you really need to find somebody, and honestly, it's a personality type thing. With a chiropractor, we're one-on-one, we're touching, we're talking to you.
Sure, it's a hands-on.
The medical doctors, it is more of a, okay, how you doing? Let's check your heart and lungs and so forth. And, okay, well, it doesn't hurt when you bend it. Well, here take an anti-inflammatory. So they give you a prescription, and that's all they do. We physically touch, push on these areas around where the problem is so that we can get the whole system working together again and reducing the pain. As far as that, you just really have to have an open mind. That's probably the biggest thing. If it doesn't work for you, that's fine. It doesn't work for everybody, but give it a chance. You definitely want to try chiropractic before you try surgery. You want to try all of these things before you try surgery. Surgery, once you're cut, it's never, ever the same.
Right.
So that's really all I can do is you really have to have an open mind to really try it.
Okay.
Okay.
Okay, so Dr. Volk, it was a great explanation. I think the viewers are going to love the interview. As far as somebody wanting to get a hold of you personally,
Sure.
How can they do that?
Well, the best thing obviously is the phone call. It's 440-946-9999. You can email me at L, like Lisa, that's my wife, by the way, .volk at sbcglobal.net.
Okay.
All right?
Great. Dr. Volk, thank you for your time.
Thanks
As
again.
always, interviews with healthy gurus. Let us know what you think. Take care.